Hello, I'm Dr. Karthika, gynecologist from Vardhan Fertility Centre. Today, let's discuss about blood tests during pregnancy. For proper understanding, we'll divide the entire duration of pregnancy into three periods. First 3 months, second 3 months, and last 3 months. In first 3 months, it is mandatory to check your hemoglobin and your blood group and all the blood counts, platelet count, everything has to be checked. And next thing is what is your sugar level. We will check your random blood sugar, HbA1c, to detect whether you are having diabetes during the pregnancy time or whether you have had diabetes before conception itself. For to know that our HbA1c test will help. The next thing is thyroid hormone test. In pregnancy, what happens? Our metabolism changes. That is, it is going in the increased rate. So to meet up that, the thyroid hormone levels will changes. So majority, 60 to 70% of the pregnant women might require thyroid hormone supplement during pregnancy. So it is mandatory to check the thyroid function test at the first 3 months of pregnancy itself. The next thing is the viral markers. Viral markers is nothing but our HIV, hepatitis B antigen, HCV, and VDRL test for syphilis. These are the routine infection markers we have to check during the pregnancy time. And one more thing we have to test is urine. Urine has to be checked for any evidence of infection is there or not, any evidence of pressure or sugar is there. For this, the urine test will give all such informations. So to summarize, the important blood test in first 3 months of pregnancy is hemoglobin, your thyroid hormone test, and your sugar levels and the viral markers as well as the urine test. Coming to second 3 months of pregnancy, we will repeat the blood test during fifth to sixth month of pregnancy. Why? Because as the pregnancy grows, your metabolic demand again it is increasing. So we have to repeat all the blood tests again to make sure everything is going fine. Whether you have become anemic, how is your thyroid levels, how is any alteration in the sugars has happened or not. So we want to ensure again during fifth and sixth month of pregnancy. So we will repeat again the hemoglobin, your sugar levels, as well as the thyroid function test, and also urine routine examination we have to repeat. The important thing is that during fifth month and sixth month, how we check blood sugar is you have to drink 75 gram of glucose and you have to wait for 2 hours. After that, we will check blood sugar. This is called glucose challenge test because at the time of towards fifth and sixth month, there are high chances anyone can get diabetes. So this test is mandatory to get it done during second 3 months of pregnancy. And again, during the last 3 months of between 8th and 9th month, again we have to recheck the same blood test like hemoglobin, your sugar levels, again your thyroid function test and urine test to be repeated to make sure whether any anemia has developed, whether you have developed any sugar or diabetes, we have to check. Apart from these routine tests, what are the other tests is mandatory is throughout in pregnancy. Once we have to check your liver function test as well as the kidney function test to make sure kidneys and livers are functioning good. And one more thing, during 7th and 8th month, since the metabolic demand increases, it is optional to go for one screening echocardiogram to make sure your heart is functioning regularly to meet the metabolic demands.